Hey guys, my name is Kirtan and welcome to the channel Physiology at Once. Today I will be talking about hemoglobin. Hemoglobin is an important topic which can come in the exam as 3 markers or 5 markers question. So hemoglobin is a conjugative protein present in the RBCs of the blood. It is made up of heme and globin. Globin is the protein part. It mainly acts to transport the carbon dioxide and oxygen from the tissues to lungs and lungs to tissues correspondingly. It also has many other functions. Now let's talk about the normal values. In the adult male, it's 14 to 18 gram per dl of blood. In adult female, it's 12 to 16 gram per dl of blood, and in newborns, it is 16 to 22 gram per dl of blood. You can notice that in the adult female, the hemo concentration is less than in the adult male. It is due to the sex hormones present in the female, which decreases the concentration of hemoglobin. Now let's talk about the types of HB. It can be divided into normal and abnormal hemoglobin. In the normal hemoglobin, we can again classify into adult hemoglobin, fetal hemoglobin and embryonic hemoglobin. Fetal hemoglobin is a predominant hemoglobin in the embryonic term. Now talking about the abnormal hemoglobin, HbS, which is also called as the hemoglobin in the sickle cell anemia. In this case, in the 6th position of the glutamic acid, it is replaced by the valine. In the abnormal hemoglobin, only the HbS is the most important. Talking about fetal hemoglobin, it is the major hemoglobin in the intrauterine life as said before. Its structure is alpha to gamma 2. It accounts for 70 to 90% of the Hb in term. So you can imagine it is the predominant hemoglobin in the embryonic term. HbF concentration increases in some types of anemia and hemoglobinopathies only in adults. So we can see increase in the number of HbF in the adults during anemia and hemoglobinopathies. Hb bars, it is the minor Hb in fetal life. It is not much important than the fetal hemoglobin, but you can still read this. Functions of hemoglobin. There are many functions of hemoglobin. The first one is transport of gases. It mainly carries oxygen in the form of oxyhemoglobin from the lungs to the tissues and tissues to the lungs in the form of carboxyhemoglobin. 1 gram of hemoglobin can carry 1.34 ml of oxygen. This is an important value to remember. Hemoglobin also acts as a buffer. It maintains the blood pH along with the albumin, which is the transport protein, which I have talked in the previous video. It also serves to destroy the nitric oxide molecule, hence it acts in the process of deoxification. It also imparts the red color to the blood due to the presence of the the heme molecule. Some clinical significance. Glycated hemoglobin. It is also an indicator of consistent hyperglycemia in the diabetic patients. It is checked after every consecutive 3 months in the diabetic patients. It is used by the doctors to check the maintenance of blood glucose levels in these patients. Glycated hemoglobin is actually formed by the binding of glucose with the hemoglobin present in the RBCs. So you can say that when the glucose is not maintained by the diabetic patient, you can see an increase in the glycated hemoglobin in these patients. It is also known as HbA1c. Now let's come to the next topic of this video, blood indices. Blood indices is used to classify anemia and has many clinical significance. The values of hemoglobin, PCV are also known as packed cell volume, and RBC count are used to calculate red cell volume and hemoglobin concentration and content. These are red blood cell indices. The commonly estimated indices are MCV, mean cell volume, MCH, mean cell hemoglobin, MCHC, mean cell hemoglobin concentration. These are the 3 important ones. The also other indices are MCD, mean corpuscular diameter, RCDW, red cell distribution width. These are not much important. Talking about MCV, it is the mean cell volume. It is the average volume of an RBC and is expressed in the femtoliters. The formula for this is hematocrit in percentage into 10 divided by RBC count in millions divided by millimeter cube. The common mistakes which students do in the exams are they forget to multiply the 10 with this hematocrit in this formula. The normal value of MCV in adults is 78 femtoliters to 96 femtoliters. The applied aspect of MCV is it is the index of size of red cells. If MCV is less than 78 femtoliters, it is microcytic, and if it's more than 96 femtoliters, it is microcytic. MCHC or mean corpuscular hemoglobin. It can be defined as the average weight of hemoglobin content in an RBC. It is expressed in picograms. The formula for this is hemoglobin into 10 divided by RBC count in millions per millimeter cube. Normal value of MCH is 27 to 33 picograms. It may be as high as 50 picograms in microcytic anemia and as low as 20 picograms in microcytic anemia. Mean corpuscular hemoglobin concentration or MCHC. It is defined as the average HB concentration per unit volume of packed red cells. It is expressed in gram per dl or can also be expressed in percentage. The formula for this is hemoglobin into 100 divided by PCB. The normal value for MCHC is 33 to 37 gram per dl. The applied aspect of this is when the MCHC is more than 40%, it indicates the malfunctioning of instrument or error in calculation. When MCHC is 37%, it's the physiological upper limit. In hypochromic anemias, HB concentration is decreased and values are as low as 20 to 25%. For easy understanding, you can remember this MCV by thinking of a big C, which is the blood, and many red boats inside this C, which is the RBCs. So mean cell volume is nothing but the average volume of an RBC. So the average volume of this boat in this big C is nothing but the mean cell volume. Similarly, to remember MCH, you can think of the big C again, which is the blood, and many red boats, the RBCs, and a person sitting in each red boat, which indicates the hemoglobin. So the average weight of hemoglobin content in an RBC. You can understand this by the average weight of a person sitting in each boat and signify it as mean corpuscular hemoglobin. Similarly, in the case of MCHC, there is a big C and many red boats, and in this it is the average HB concentration per unit volume of packed red cells. So it's not a single boat but a group of boats and the weight or concentration of the men in these boats. So I hope you understood in this video. If you found this video informative, please like, share and comment and subscribe for more videos like this. Thank you.